Hi, this is Dr. A. Welcome to Corner of Dr. A, where psychology meets practical wisdom for a healthier mind. Today, I want to talk about depression. We often use this word lightly or interchangeably with sadness. When we feel sad, we say, I'm depressed. But sadness and depression are not the same, and understanding the difference matters both for your mental and physical health. Sadness versus depression. What's the difference? Sadness is a natural, temporary, and emotional response to life events. You lost something or someone important, you face disappointment, and your mind is grieving or adjusting. Depression, however, is different. Depression isn't just one heavy break, it's a pattern of weight on the mind and body. It's a clinical condition defined in the DSM and ICD-10 as a persistent low mood or loss of interest in activities you once enjoyed, lasting for at least 2 weeks, often accompanied by changes in sleep and appetite, low energy or fatigue, poor concentration, feelings of hopelessness or inappropriate guilt, recurrent thoughts of death or suicide. Depression isn't feeling sad. It's more like the color has drained out of life and nothing feels meaningful anymore. Why does knowing the difference matter? Words matter. They shape how your brain perceives and processes emotions. There is a saying, when you control your mind, it's powerful. But when your mind controls you, it's dangerous. If your brain believes I'm depressed, it will recruit memories, sensations, and even body responses to match that narrative. But if it knows I'm sad for a reason, it's more likely to contain the sadness, check if the cause is still present, and then let the sadness dissolve. Cognitive behavioral therapy studies have shown that labeling emotions accurately helps reduce their intensity. In contrast, mislabeling or catastrophizing strengthens neural pathways associated with pain and distress. Think of it like this. If you keep saying, I'm depressed every time you feel down, you are training your brain to expect a storm even on partly cloudy days. Your mind's tornado. When your emotional intensity spikes, maybe some days feel like a 1 or 2, but others like an 8. It's like your mind is hit by a mental tornado. Your whole mental house gets sucked into the storm. But unlike Dorothy, you don't lay it in Oz with a yellow brick road and munchkins singing you to safety. Instead, you are left in the gray, feeling blue. And here is the thing. Every time that happens, your brain remembers the chaos. So, even when the next emotional wave is mild, it feels stronger because the memory of the past traumas gets triggered. Yes, your brain works like that. The brain snakebite story. Do you know the story by the Australian pain scientist Lorimer Moseley? His story explains this perfectly. The first time he was walking through the bush and felt something scratch his leg. He thought it was just a stick brushing against him. So his brain didn't trigger pain or panic. But later he fainted, and at the hospital he found out it had actually been a venomous snake bite. The next time he was walking in the same area, something brushed against his leg again. This time, his brain did sound the alarm. Sharp pain, instant reaction, even though it was just a harmless tick. Why did his brain overreact? Because it had learned from the earlier near-death experience to associate even a small brush with danger. The brain prioritizes survival over accuracy. Our brains learn from emotional pain the same way. What can you do? Check in with yourself. Ask, am I sad about something? Did something happen? Is this grief, stress, or is it lingering for no reason? Track your emotional intensity. On a scale of 1 to 10, how down do you feel today? Some days might feel like a 2, others like an 8. If your average is 5 out of 10, that could indicate mild depression, according to PHQ-9. But if some days spike to 8 or 9, it's worth seeking professional support. Don't self-diagnose. Talk to your primary care provider, a psychologist, or a psychiatrist. They are trained to help you identify whether it's sadness or depression and guide you toward healing. Quick tips for emotional resilience. Name it to tame it. Label emotions accurately. When we say I'm depressed or I'm sad, it sounds like we are describing our identity. But think about it. When you have the flu, do you say I'm flu? Of course not. You say I have the flu. So instead of I'm depressed, try saying I feel sad. And here is why. It's a small shift in words, but it changes how your brain processes the experience. Move your body. Regular physical activity has been shown to lift mood and calm the nervous system. Connect with others. Isolation fuels depression. Even small social interactions can help. Limit rumination. Redirect your focus to soothing or productive activities. Practice mindfulness exercises. When the mind is calm, it helps prevent unwanted feelings from entering or lingering, and it supports the healing process. Thank you for watching Corner of Dr. A. If this resonated with you, please like, comment, follow, and share it with someone who might benefit. Until next time, stay happy, healthy, and support your mind and brain with the right words.